Welcome to Little Growing Bones, the podcast we explore the latest insights, treatments, and stories in pediatric medicine. So, Judith, how can you describe what Blount's disease is?
So, Blount's disease is a condition that's just found in children, and it's associated with bowing of the knees. So there are many
Mhm.
conditions like that that cause the knees to bow out, but this is
Yeah,
just particular to children. You'll find that the children are
okay.
actually healthy. They have a great diet. They don't have any other
Yeah.
medical conditions. However,
Mhm.
they seem to have the legs bowing outwards. And even though it's typical for children to have bowing of the legs, especially those under 2 years, um, this is not normal. This is not considered physiological. It's an abnormal variation that causes the kids' knees to bow outwards. It can happen in just one leg, or it can happen in both. Yeah.
So, is this something that maybe you could say you need to be predisposed to it genetically, or is it something that happens because of some traumatic injury and it's just a post-traumatic outcome of that injury?
So we don't exactly know what causes Blount's disease, but we have identified a few risk factors, and these seem to be, common in most of these kids who present with Blount's disease. One of those
Mhm.
is children who tend to walk early. So kids who walk as early as, I don't know, 8 months, 9 months have been seen to often have Blount's disease or often found to have Blount's disease.
Mhm.
Um, children with children who are heavy, so those with a higher weight than is normal for that age, have also
Mhm.
been found to have Blount's disease. It's common. It's more common in people of African descent. I mean, it cuts across. You see it in very many other races, but it's more common in people of African descent. There isn't a particular genetic predisposition to Blount's, but we can't say for sure.
Okay. Um, so, in your typical practice, if a patient walks into the practice, what are some of the sort of symptoms that you look for, and how do you diagnose patients with Blount's disease?
The parents will normally tell you that, well, child was okay and suddenly started having bowing in the knee, whether it's one knee or both. Or sometimes they'll tell you they've actually always had bowing, but we're noticing that it's worsening. Um,
Mhm.
and now we are concerned that it's just going to keep going and going. When
Right.
these kids are walking, they'll tend
Mhm.
to sort of have something called a lateral thrust. So lateral thrust means like as they walk, their knees sort of give in too much,
Like
too
it's
much.
pushing outwards.
Sort of, yeah, exactly.
Mm. Mm.
And that's quite distinct to kids with Blounts. So overall, they'll have bowing of the knees. They could walk with a bit of a limp, especially if it's one-sided.
Mhm.
Their feet are normally really turned in, or if it's just one side, that foot could be
Mhm.
more turned in than the other normal side. They could walk with a bit of a lateral thrust, like you mentioned, and they could also appear slightly heavy sometimes. Yeah.
And these patients are treated how in your hospital or in your practice? And also maybe if you can give insights in terms of from what age do you start treating them, and up until what age that you can provide treatment for them?
So that treatment, before I talk about treatment, I'll sort of classify how we talk about Blount. So
Mm.
we classify Blount based on the age at which they come to us, or at the age at which they start having the symptoms. So in the very young kids, so I would say kids between 2, 3 years to about
Mhm.
5, 7. We
Mhm.
have we call it infantile Blounts. So this is the kind that affects in kids that young. And in the older children, so typically anyone over 9, 10 years, then we call that adolescent Blounts. So to sort of take you back to how the whole Blounts thing happens. Kids have something special on their bones called the growth plate. So the growth plate is it's such a beautiful thing. It's such a versatile thing. It can make kids' bones do all kinds of amazing things, like heal in record time, or correct deformity that you like, that will like that if left in an adult, you'd be like, this is criminal, right? So growth plates can do all these amazing things, but they can also do the worst things, like if you mess with the growth plate, if a growth plate is injured, it doesn't repair right, or if it gets sick, then it could cause such terrible things, things from the bone not growing any longer to the bone undulating, or having kind of curve or kind of thing. So I do have a model of a sawbone. This is a sawbone.
Lovely.
This is not a real bone. But this is in the leg. So by the leg, I mean anything, that segment of bone from the knee to the ankle joint. So imagine this is the knee joint and this is the ankle joint. This is the tibia. So the leg has two bones. This is the smaller bone called the fibula, and this is the bigger bone called the tibia. So the tibia is what carries your weight. The fibula doesn't contribute much to weight bearing. It has its role, but as far as weight bearing, we mostly talk about the tibia. So at the top of the tibia, in a growing child, we have the growth plate like about here. Okay. So in children who have Blount's disease, the growth plate the growth plate typically spans the whole tibia. This is the inside and this is the outside. So medically we call this medial and this is lateral. So the inner part of the growth plate sort of is diseased. So think of it as not acting normally. So instead of growing at the normal rate, its growth is the rate at which it grows is really slowed. Okay. Then the outer growth plate is normal, so it continues to grow.
Grows.
Yeah. So because it's growing and this is not growing at the same rate, it grows more outwards. And so you get that typical bow.
So that's why you get that slanting effect on the tibia. Okay.
So this continues to grow. This is sort of tethered back, and then the leg starts to grow outwards. So when you see that deformity, you'll notice that the leg typically has that bow, and when we investigate them, which you typically do through radiographs, so by doing X-rays, you can see the bone and see what is going on in the bone, and we'll see that this growth plate is working, it's nicely open on the outer side, while the one on the inside is not looking very healthy or completely closed off prematurely. So when we are devising the treatment, we are trying to correct and reverse what has happened. Okay. So in my setting, the way I treat or the current standard of treatment for Blount's disease is based on age and the degree of deformity. One thing we have to know is that this is something to take home is that in Blount's disease, the growing part, the inner part of the bone is not growing at the same rate as the outer side, or maybe even not growing at all if it's that far gone, and that causes the bone to bow out. So when we are treating, we predominantly want to correct the deformity, which is the bowing out of the knee, bowing out of the leg, and we do that through different modalities. So we can do it through growth modulation. So growth modulation is where we are using the growth plate to our advantage to sort of guide the bone to continue to grow out and straighten out the way it should. And I've created a few videos in the past that I will actually link in our in the description below that talk about guided growth, and they can just give you an idea on what to talk about there. But what we typically do in guided growth is we put something to tether the growth plate on the outer side, or to tether the growth plate that is growing outwards, and sort of hold. So it sort of slows down how fast it's growing as this side catches up. Okay. So, and then we wait, and over time, it should correct out. That is more favorable in the younger children. So in the kids who have infantile Blounts, that's where we mostly do that. And
how long would that take, the treatment period for such an intervention?
Yeah, so that typically when you do guided growth surgery, we expect, well, still the disclaimer here that it's very dependent on the age of the child, the kind of deformity you're treating, and the underlying condition. So when we are treating children, most of them, in a period of 8 to 18 months, they're fully corrected. In Blount's disease, it's much slower. So again, you have to remember this is not a healthy growth plate, so it's going to take much slower, much longer than previous. So I can't put a time on how long it takes for Blount's, but I would say that it's much slower than what they expect even for younger children. But still, we continue to follow them up every 4 months to make sure that we are getting what the result that we want, which is ultimately restoration of a straight leg. And so the treatment doesn't take away the Blounts, it gets the leg being straight, which is what we want, so that they are not loading all their weight on the inner side of the leg, and they're sharing that weight on both sides in the knee. Yeah.
Right.
So growth modulation is normally a less
the preferred method.
Yeah, it's a good alternative, but because we know that this condition is it doesn't cure it, and because in some literature they've actually stated it being ineffective, the other option we have is osteotomy. So osteotomy means we cut the bone, align it out the way we want it to, and then hold it in place. So the correction of this deformity can depend on how severe the deformity is. Some deformities are like really, really, really over 60 degrees, over 90 degrees of angulation, that you don't want to do that too suddenly, because you could risk injuring the vital things around the knee, so things like the blood vessels and the nerves. And so we can do this gradually. So when we do an osteotomy, the speed at which we do the correction is dependent on how severe the deformity is. So we could do it acutely, where we go, resect the bone, make it straight, and hold it. Or if the deformity is really bad, then we can do that with gradual correction with frames like the orthopediatric frame, and ultimately get that required that result we want of a straight leg.
Okay, so if you didn't do this early intervention that you've mentioned, and the patient grows into a teenager and the Blounts is left untreated, what sort of implications would that have if Blounts were left untreated?
So the implication is that the deformity will just keep progressing. So as long as the growth plate is open especially on the outer side, the bone continues to grow. So if left untreated, if it cuts off bone like this, it will just keep going and going, and then you'll find that it's really angulated, that someone is walking with the legs basically like that. So that is the biggest issue, is that they progressively keep progressing. The deformity keeps progressing. The other thing is that when you're standing, you want to be distributing the weight evenly through the inner side of the knee and the outer side of the knee. So if
Right.
one side is working harder than the other, then you're going to wear away at your cartilage, and
Right.
and that joint will degenerate, and therefore it will give you premature arthritis. And
Right.
with premature
Right.
arthritis comes pain, comes restriction in moving the joint, comes difficulty walking long distances. So the whole everything that comes with a arthritis of a joint, arthritis, um, is a sequelae of non-treating that condition in time. Yeah.
You did mention earlier as well that sometimes this is caused because of the patients being a little bit maybe overweight or obese or whatever. So would you consider weight reduction as a non-surgical intervention to treating Blount's disease, or would it by that time the patient is already presenting with Blount's and the only way to do it is either to perform an osteotomy or to sort of intervene with the cross plate?
So yes, that's an amazing question. So for every child, irrespective of the condition, that come in, they have a BMI that's higher than it should be. Kids who come in and their weight is higher than should be expected for that age, there's always counseling on, either it's dietary or name it, things that can be done to try and get the weight back to preferably within the expected limits for that age and height.
Yeah.
And the dietary management is normally the biggest part, together with the incorporation of exercises, is something that we advise a lot on. And even though the surgery does fix the problem, advising them about the weight management is something that that is still incorporated in the care, because it doesn't stop at being a risk factor for the Blounts. It puts them at risk for other conditions as well, cardiovascular conditions, um, different medical conditions that are as a result of diabetes, that are as a result of high body mass index. And yes, it's something we do counsel them on. So we refer them to the nutritionist and the respective multidisciplinary teams that can help them to deal with that.
Okay. Well, Judith, thank you so much for educating me about the Blount's disease. I'm pretty sure a lot of people watching this episode will appreciate the information that you've shared. And friends, that wraps up today's episode of Little Growing Bones. We hope that this deep dive into Blount's disease has given you a clear understanding of the condition and the importance of early diagnosis and treatment. If you found this episode helpful, please consider sharing it with others who might benefit from this information. And don't forget to subscribe so that you never miss an episode. And if you have any questions or topics you'd like us to cover in the future, feel free to reach out. Thanks for joining us today. Until next time, take care and keep prioritizing your child's health.